வணக்கம் டியர் நண்பர்களே, என் பேர் டாக்டர் ஜெய்சங்கர். நான் கோடம்பாக்கம் சென்னையில் உள்ள மெட்வே ஹார்ட் இன்ஸ்டியூட்டில் டைரக்டர் அண்ட் கிளினிக்கல் லீட் கார்டியாலஜி அண்ட் எலக்ட்ரோஃபிசியாலாக பணிபுரிந்து வருகிறேன். So the next question after diagnosis of blood pressure is, how often should I check the blood pressure and what should be the target? I should check the blood pressure. I should have a home blood pressure monitoring. Just like we do a home sugar monitoring, it's fairly easy. It's not expensive, the machine, and it's very easy for any of us to understand and follow the instructions. It's battery operated with a click of a button, and within 30 seconds we know the blood pressure. So always the home blood pressure is more reliable than the clinic or office blood pressure. The reason being, whenever the patient visits the hospital or visits the doctor, the blood pressure goes up subconsciously, and that may not be a reliable reading. This is called white coat hypertension. The moment we see the white coat or the doctor, the blood pressure goes up. So home blood pressure monitoring is paramount. And how often should I check? At least once a week. Till the control is reached, adequate control is achieved, we should check as often as possible. Could be every day or every alternate day at different time hours of the day. And once adequate blood pressure control, that is 120/80, is achieved, at least once a week, measurement is paramount. So blood pressure can be controlled by lifestyle modifications in the form of restriction in salt intake. When we say restriction in salt intake, we are looking at no more than 5 gram of salt intake per day. So 5 gram amounts to 1 tablespoon. So let's see how much we consume salt. We as Indians, we consume a lot of salt in every foodstuff we eat. So we need to restrict that. We are salt sensitive. Many times restricting the salt in itself brings down the blood pressure dramatically. Next important thing to do for blood pressure is regular physical activity. Something like 30 minutes of brisk walk a day, 5 days a week, or 150 minutes per week. If somebody is not known to have heart disease, he can even do vigorous exercise in the form of running, walking, jogging, cycling, swimming, or even hitchhiking and mountaineering. So all of them tend to burn the calories and also make the patient achieve good blood pressure control. So first is salt intake, second is regular physical activity, third is cessation or avoidance of smoking. So if somebody is a smoker, the chance of him having high blood pressure is very high. So quitting the smoking alone may bring the blood pressure down. And of course a diet which is we say hypertension friendly, wherein the patient avoids animal fat and takes plenty of seafood and avoids oily food stuff like ghee and butter, and all the time with this kind of a diet and exercise regime, we can get the blood pressure down by something like 10 to 15 millimeter mercury systolic, that is upper reading, and 5 to 7 millimeter diastolic, the lower reading, just by doing diet and physical activity.